Welcome to the deep dive. Today we're jumping into some source material about a pretty major cyber incident. Had a big healthcare network here in the US.
Yeah, this one's definitely got layers to it.
We're focusing on a bleeping computer piece. It's by Sergio Gatlin, came out May 21st, 2025. And it really details this cyber attack on Kettering Health. They're, a large healthcare system over in Western Ohio.
A very large one, actually.
Exactly. So our mission basically is to unpack what this report says happened, get a handle on the immediate impact, and look at what the cyber intelligence folks mentioned in the article, think about who might be behind it.
Sounds good.
Okay, let's unpack this.
Well, when you see critical infrastructure like a hospital system get hit, the fallout, it's almost never just about the data or the computers.
Right.
These things directly impact actually delivering care to patients.
Oh,
So it
yeah.
makes them so concerning.
And Kettering Health is big, which means any problem hits a lot of people. The source mentions 14 medical centers, emergency centers, over 120 outpatient spots across Western Ohio. Yeah, and they've got over 15,000 staff, including like 1,800 physicians. So hitting a network that big, that's instant widespread trouble.
That scale is absolutely why this outage was such a huge disruption. The article talks about a system-wide tech outage, and apparently their call center got hit too.
And the immediate thing, the really visible impact mentioned in the source, was canceling elective procedures, both inpatient and outpatient.
Right.
That was for Tuesday, May 20th specifically. Just think, if you were booked for surgery or something that day, it messes up your plans, your health.
Definitely stressful for those patients.
Yeah. But the article is careful to point out their ERs and clinics, they stayed open, still seeing patients. So emergency care wasn't totally stopped, which is important.
That's a key distinction. Yeah. And Kettering Health themselves, on their website, they confirmed it wasn't just some IT glitch. They called it a cybersecurity attack.
And then there's this other weird, worrying thing happening around the same time, right? The source talks about scammers calling patients, pretending to be from Kettering Health, trying to get credit card payments over the phone.
Oh, wow. Opportunists.
Exactly. The article does say these calls aren't yet definitively linked to the main attack itself, but it's like, people trying to cash in on the chaos.
It absolutely adds another layer of worry for patients just trying to figure out what's going on.
Totally. And Kettering Health did the right thing. They announced they would stop calling patients for payments over the phone for a while.
Smart move. Protect people from those scams while things are confusing. You might expect calls about rescheduling, so it's good they clarified the payment part.
Okay, so given the huge system outage, the confirmation of an attack, what are the intelligence sources saying about the kind of attack this likely was?
Well, based on just how disruptive it was operationally and what the threat intel sources told Bleeping Computer, all the signs really point towards ransomware.
Ransomware. Makes sense for that kind of system-wide shutdown these days.
It's the most common culprit, yeah.
And did the article name a specific group?
It did. According to ProDaft, that's a cyber threat intel company, they attribute this attack to a group they call Nefarious Mantis.
Nefarious Mantis. Sounds dramatic.
Doesn't it? And they say this group is part of a bigger cluster they track as Interlock.
Okay, Nefarious Mantis, Interlock Cluster. What do we know about them from the source? Are they known players?
ProDaft mentioned that Nefarious Mantis has hit U.S. healthcare and biotech targets before. So there's a pattern.
Ah.
And what's interesting is their technique. They apparently use something called the Interlock Rat. RAT stands for Remote Access Trojan.
Okay, ARAT. So for listeners, that's basically malware giving attackers backdoor access, lets them control systems remotely, right?
Exactly right. And ProDaft says they use this Interlock Rat to look around inside the network, internal reconnaissance they call it, and to keep their foothold.
So it's not just smash and grab. They get in, poke around first.
Precisely. It suggests a more planned, targeted operation. They're doing homework inside the network before launching the main attack.
And how does that RAT usage, lead to the outcome we saw at Kettering, the big outage?
Well, ProDaft connects those dots directly. They told Bleeping Computer, and I'm quoting here roughly, that in several cases, this activity led to the deployment of Interlock ransomware.
Ah, there it is.
Resulting in operational disruption and potential data loss. And apparently a CNN report also linked the attack specifically to the Interlock ransomware operation.
And with ransomware, there's often that ransom note left behind, right? Did the source mention anything like that?
It did. It mentioned reports of an alleged ransom note showing up on encrypted machines inside Kettering's network.
What did it say? Any specifics?
The quote mentioned was something like, Your network was compromised, and we have secured your most vital files.
Secured your most vital files. That sounds like they didn't just lock them up, but maybe took copies too, the data exfiltration threat.
That's exactly what it implies. It's a common tactic now, not just encrypting, but stealing data and threatening to leak it if the ransom isn't paid. Adds pressure.
So this interlock group, or nefarious mantis within it, are they like a long-running established ransomware gang, or are they newer on the scene?
That's one of the interesting bits from the article. Interlock is described as one of the newer operations, apparently only really popped up in September.
Since September, just last fall, and they're already hitting major healthcare networks like this. Wow.
Yeah, that's fast. It really shows how quickly these groups can spin up and become, a serious threat. The article says since September, Interlock's already claimed over 3 dozen victims.
3 dozen victims in just, 8, 9 months? That's prolific.
It really is.
Did the source give any other examples, just to get a sense of their impact?
Yes, it did. A pretty concrete one, actually. It mentioned Interlock breached DaVita.
DaVita, the kidney care provider. They're huge, Fortune 500.
That's the one. And in that case, Interlock allegedly leaked 1.5 terabytes of data.
1.5 terabytes. How many files is that?
Nearly 700,000 files, according to the source.
700,000 files.
Yeah.
From a healthcare provider. That's staggering. The potential risk here for Kettering health patients if data was stolen must be immense.
It really underscores the danger. Healthcare data is incredibly sensitive. Personal health info, financial details maybe.
Yeah.
If that gets out, you're looking at identity theft risks, medical fraud, serious long-term problems for people.
And that threat to leak it, like the note hinted at, is the leverage they use to try and get paid.
Exactly. It's a nasty evolution in ransomware tactics.
So, okay, the intelligence points pretty strongly towards interlock, ransomware, data theft, threat. But the article mentioned some lingering questions, right? It wasn't all sewn up.
That's right. It's important context. When the Bleeping Computer article was published, Interlock hadn't actually listed Kettering Health on their dark web leak site yet.
So no public claim from the attackers at that point.
Correct. And Kettering Health itself, when asked by the reporter, hadn't publicly confirmed it was specifically ransomware. They confirmed a cyber attack, but not the ransomware label specifically.
Okay, so strong indications from Intel, but maybe not full public confirmation from all sides just yet. The picture is still developing.
Exactly. But the evidence cited, based on the outage type and the observed activity, points heavily in that direction.
Man, this whole situation really highlights the different layers of impact from just one incident, doesn't it?
It really does.
You've got the immediate hit to hospital operations, patient care getting disrupted,
Wow.
then the potential long-term risk to everyone's personal data.
Which is huge.
And on top of that, these unrelated scammers just jumping on the bandwagon, trying to exploit the confusion.
It's a perfect storm, really. Why this matters so much is that an attack on healthcare isn't just an IT problem. It's a multi-front crisis.
Yeah.
It hits people's health directly, it shakes trust in essential services, and it puts incredibly sensitive data on the line. The scam calls just show how wide the ripples spread, impacting everything from the network itself, right down to how patients communicate with the hospital.
Well, that seems like a good place to wrap up this particular deep dive into the Kettering Health cyber incident.
Yeah, I think we've covered the key points from the source. We talked about the system-wide outage at Kettering Health after the cyber attack, how it immediately messed with things like elective surgeries and their call center.
Right, and the cyber intel pointing fingers at the Interlock ransomware group, possibly that nefarious mantis actor within it.
And the implied threat of data being leaked alongside those separate opportunistic scam calls that popped up.
So if we kind of connect this to the bigger picture.
Well, these kinds of ransomware attacks, hitting healthcare specifically, they seem to be escalating, and they are incredibly damaging. You see massive operational problems, real impacts on patient care and safety, loss of trust, and then these huge long-term risks around patient data privacy and security.
It definitely raises questions about more than just preventing the initial hack, right? It's about handling all the fallout, too.
Absolutely. Resilience is key.
So what does this all mean? Here's something to think about. How just one single point of failure, like a successful cyber attack getting through, can cause these massive ripple effects. It disrupts patient care, puts personal data at risk, and even, opens the door for totally separate scams targeting people who are already worried.
Yeah.
Think about all the different vulnerabilities that get exposed in these interconnected systems, especially in critical places like healthcare. It's not just the IT network, it's the communication channels, patient trust, everything. What does an event like this suggest to you about just how complex and multi-layered these cyber threats are today? And maybe what does real resilience look like? Is it just building higher digital walls or is it something more?